welcome to Andy Straley Veterinary Hospital. It is our hope that these series of videos will help both you and your pets. Today we're going to talk about good dental health. This is Pet Health Month for dental hygiene, the month of February, and we always try to celebrate this month by offering a special on our dentals. And I'm going to talk about this in a general fashion so that it's not too complicated, but it gives you an overall view of what we're trying to do. This is Lola. She's volunteered to help me with this presentation, and I wanted to show you how you can look at your own pet's teeth and decide whether or not they need to have them cleaned. And look at the front teeth. The back teeth frequently are the ones that need to have some attention. Lola's teeth are in good shape, but it won't be long before she needs to have another dental. This is very common as they get older, and they need to have this done generally about once every 1 to 2 years in order to keep their mouth in good shape. This is a model of a dog's mouth, and this shows the teeth as they should look. They're nice and clean, the gum line's nice and clean, there's no tartar, they're nice and white. This side shows a mouth that's having some problems, and this is what you want to look for on your own pet's teeth, dog and cats. You'll see the tartar build up along the edge of the gum line, especially in the back. You'll see some inflammation of the gums, which indicates that there's low-grade infection. This infection, it not only affects the mouth and the odor of the mouth, but it also affects the liver, kidneys, and heart. Older animals especially are particularly prone to having problems with this and can die from kidney failure in many cases, as well as heart and liver trouble, as a result of just having a mouth that needs to be cleaned, that hasn't had enough attention. They're keeping teeth that they don't need and they need to have removed. So what we try to do with a dental is just like a dentist does with your own mouth. We'll put them under sedation, and so that they're relaxed, they're not fighting us. This is necessary. Most pets are just not going to tolerate this. And then we clean all this off. We also put them on antibiotics to help the mouth heal and to protect them against the bacteria that are going to go through the system after this is cleaned off. There's going to be a cascade or a release of bacteria into the system, and it can cause some major problems, especially for the kidneys, liver, and heart, as I already mentioned. So it's important to have them on antibiotics 2 to 3 days beforehand and 4 to 5 days afterwards. So that's something that you need to make sure is necessary. We also would recommend that you have blood work done prior to this because they are under anesthesia. We want to make sure they're in good shape, and we want to make sure that we don't have any surprises, and that's where the problem comes from, is the anesthesia. So you need to make sure that that's done. Afterwards, if you can, we have toothpaste and toothbrushes that we would recommend that you use. Your veterinarian has this, and this is something that most everyone can do. It's not easy. You have to get them used to it. If you can do it at least once or twice a week, it's great. So do the best you can with that. That's what we suggest. Otherwise, it's going to be necessary, generally every 1 to 2 years, to have their teeth cleaned. And Crystal and Anita are doing a dental here to clean Spike's teeth. And Spike is under anesthesia, gas anesthesia. He also has a drip line that we use to monitor their blood pressure and EKG, and we have monitors on this to watch all of this.
You need to flip them on.
And you can see how Crystal is cleaning the insides of the teeth as well as the outsides. And we're also testing how firm these teeth are in the gum line. Sometimes if they're real loose, they're not going to tighten up and they need to be removed.